Since we are speaking about, chatbots and, chat GPT and artificial intelligence, ladies and gentlemen, we've even been talking about health tech. When we talk about health tech, what we have certainly kind of established by far is that, we've actually brought in guests, who actually spoke about how they've made these robots and how we can communicate with any doctor anywhere in the world, or maybe anywhere in Pakistan, making sure that each and every one of us will actually get that dispensable, healthcare services. And I think that's what certainly everybody wants. No, Aja?
That's true. That's true. And I think that the technology can actually bridge the gap between those who cannot access the healthcare. And we have seen that a lot of our population which resides in the rural area, there are a lot of technology, the healthcare companies who are integrated with the technology, they're actually making a difference in those particular area. But having said so, we are going to debate, is the technology-induced healthcare a great leveler or a great divider? Because certainly the access of the technology is not that great, especially when it comes to the rural area. So we're very glad that we have been joined by Sana Khan, who happens to be a healthcare enthusiast and a master trainer. Assalamu alaikum, and thank you so much for coming to our show.
Thank you so much for inviting me.
I mean, it's wonderful to have you over here. First up, what we would certainly like you to do is that, for all our viewers in 46 different countries, tell them, what is health tech? How do you think that it will give us more opportunities, whether it's going to give people more opportunity to, to get access to healthcare services? Let's start from here.
Right. So, for your first question, I think healthcare में tech की जब बात आती है तो for the most part पाकिस्तानी startups जो हैं वो focus करते हैं किसी ना किसी app development के ऊपर.
So we'll have to do it in English because we are an English channel. If you're comfortable with that.
Sure. Why not? So when we talk about healthcare, typically what startups do in health tech in Pakistan is that they would probably develop some kind of an application where consultants are there, patients are there, they're connecting them, they're booking their online tests, their consultations, lab tests, and probably even one step ahead, getting in the consumer market of the pharmaceuticals and delivering them the medicines.
True.
That's the only aspect that we've been into so far in Pakistan. But with
what other aspects are there?
Sorry?
What other aspects?
I'm coming to that.
Thank you.
So what other aspects I'm trying to explore and I want to work in, just like we've been talking about ChatGPT and how generative language learning abilities of AI and other algos are coming into play, I want to do it one step ahead, and that would be that, yes, doctor-patient consultations are going to be there in the app that we are developing at HospitALL, but I would also think that Pakistan has a lot of load in terms of patient care when it comes to secondary and tertiary and even quaternary hospitals and healthcare. And why is that? I see the problem because for every 5,000 patients in Pakistan, there's just one consultant. I'm talking about specialists, right? So that needs to be cut down, and that would be cut down only when you have the preventive care facilities in every locality, in the urban and eventually in the rural setups.
So when we say that, we need to have preventive care facilities, what are we trying to refer to? Because that's a terminology we've heard for the very first time, preventive care. I mean, it's not that we haven't heard about the word preventive care, what it means, but a facility which is actually going to give us that preventive care is something which is new to us. Can you please explain on this?
Sure. So how I envisage it at HospitALL is that I want to establish Center for Excellence. It's like a smart family clinic. When you walk into it, you're not escalating the problem right into the secondary or tertiary care hospitals. You're not directly going to the consultant because obviously that's not necessary in a lot of cases. So preventive care and early diagnosis is what my Center of Excellence smart family clinics are when they're coming into play. And what they're doing is that, the vitals, the triage, the general practitioners are there, and they are going to escalate the problem to the right kind of consultant. That saves the time for both the patient and the consultant.
But if we are talking about preventive care, that means that, we might not even end up having a disease, God forbid. I think that's what we're referring to, right?
Of course.
So then why do we actually really need to escalate that to a specialist?
That's need-based,
God forbid if there's a requirement.
God forbid if there is, and if there is not, that's the unnecessary road that's already going to the consultant. So that will be saved.
So then are you trying to say that we really need to build up on a culture where people, just before getting ill, actually have this very mindset that they go to a doctor, get themselves checked up, routine tests, just like annually, there are a lot of people who get themselves checked up, all the tests being done, whether they are healthy or not. So is that the kind of a setup you want?
I want to build that setup, and I also want that this lifestyle modification and the holistic health and wellness approach should be countrywide and should be affordable. Should be affordable and accessible to everybody.
Exactly.
That's
so
the
health
vision.
is wealth, right?
Yeah.
So you can get the health which is equivalent.
Alhamdulillah, we're very wealthy. Shukr alhamdulillah.
Alhamdulillah. So it is said about the telemedicine that it will certainly revolutionize the access towards the healthcare, but we have seen that definitely it was not the case, because there was a lot of hype regarding it, and we have seen that there are a lot of telemedicine platforms. For example, Sehat Kahani is one which has made access, revolutionize the telemedicine, not just for the patients but also a lot of physicians, because Shahzad, we all know that the society's obsession with the Dr. Bahu, and when they get married they're not allowed to even work, right? In a lot of cases. So Sehat Kahani has definitely captured those segment of the society or the physicians who are not able to perform. So what is different that you are offering in this your setup?
Right. So at HospitALL, I'll talk about the competitive edge. I'm seeing 3 verticals here. So number 1 is B2B healthcare. When you come into corporates, there's a lot of iteration, there's a lot of lag in the training development, and it's a lot of load for the HR when your employees get sick and they are on the sick leave. There are a lot of insurance claims, there are a lot of even bogus medical claims. So that is where the HospitALL is going to come into play for the organizations, saving them a lot of money, saving them a lot of time, and also a lot of training time. Obviously when they take training time for the employees and then they get off and their deadlines get disturbed. Second vertical would be B2C, where I'm going directly to the client or the consumer or the patient, and I'm offering them a 360-degree holistic healthcare, wellness and fitness plan. And that includes reproductive health, mental health, which nobody's talking about. Even reproductive health is least talked about in Pakistan. It's the most prevalent issue, and that's probably my own personal statement for coming into healthcare after the 8 years of training career, because I've been battling with the problem for 6 long years, and it could have been avoided if I had we had the culture. If we had the culture in Pakistan for unmarried girls to go to the gynae without a taboo.
Right.
So I want to make that accessible and affordable for every woman in Pakistan.
Right.
That's where the competitive edge comes in, and that's not only going to be solved with an application, because application is for urban areas. They're for well-trained people. Everybody might not have access or the understanding for that.
And thank you very much for highlighting this issue as well. And I still do believe that it is a very relevant issue, but I think that there will be other societal issues which will rise alongside this as well. So imagine that if men or women would get themselves to be tested first, beforehand, before marriage. I think for women, number 1, obviously, then the other families won't certainly be interested in getting married. Number 1, that's going to be a huge problem. Number 2, men over here do have a taboo that they certainly think that they are the ones who are actually perfectly well and fine, and that the lady really needs to be tested as well. And I think I stand against it, because in the first place, and we have recommended about it, we have spoken about it, we have suggested it, that in the first place, if the man himself gets himself tested, that's way cheaper than the women getting tested as well. So I think that there are other issues, but it's good that you're going to address it, and people certainly really need to be tested beforehand, so that at least you would know that if there's, God forbid, any STD or anything other than that which is related or which can actually have an impact on their spouses or partner's health. That's a brilliant idea, but there will be other issues alongside it as well. But having said that, you spoke about B2B, you spoke about B2C, so one-on-one as well. But having said that, you said that there are major bogus medicine claims as well. Right. Half of the time, it's not just only the patient who's actually making these bogus medicine claims. It's the physicians too. Unfortunately, in Pakistan, that's the that's the equation. So how do you think that the physicians and the people who've been really interested in doing so, which has been a culture of our pharmaceutical industry in the first place, then the medicine industry everywhere, how do you think that they will, kind of build up on your idea? Do you think that they will like it? Because you will be the one taking away all the extra money from them.
I think organizations will like it a lot. Obviously. So that's where I'm focusing on, because if I
no bogus sick leaves as well.
Yeah. That is something that I think actually helps organizations save a lot of money and time, as I already said. But I would also like to build on the point that you were talking about, the social impact. So I've talked about one vertical, that's B2B. That's saving organizations time.
True.
And that would ultimately increase the quality of the pharma and the healthcare and the physician ecosystem as a holistic approach in Pakistan. Second is B2C, where I'm hitting the patient directly. Third vertical was exactly the social impact. It comes with a lot of taboos. It comes with a lot of deep conditioned societal problems where I am hoping to help Pakistan. 10 years ago, maybe nobody was talking about breast cancer because that was, the word alone was not to be uttered in a public space, right? Let alone by women. But I want to break that taboo by helping creating awareness, starting from the urban areas and spreading out into the rural
And I think
ones.
I would want to certainly thank Aftab Sahab over here, who's been actually, kind of making sure that he kind of raises awareness about breast cancer as well. And this is the first ever center which is being built in Lahore, the Pink Ribbon people. Aftab Sahab, if you're out there. And having said that, I think whenever you kind of design that application, please make sure that you give it to World This Morning, because one of our producers, Asnan Hamid, he actually falls ill once or twice during the week. Otherwise, so Asnan, if you're out there, if you're watching us, bete application aa rahi hai, phir teri chutti nahi ho sakegi.
And let's talk about, because you mentioned about the data, the health commerce, right, in our conversation, and I was really fascinated by this concept because health and commerce doesn't seem to match up for me, but you have, match it up. So what does that exactly entails?
Achha, so the first part of the question that you've talked about health commerce, I would like to mention a small number. In 2023, we are hoping to generate $129 million in the healthcare industry alone in Pakistan. I'm not talking about any other country.
How much do we generate already?
We generate 15% less.
That's it?
Yeah.
So why do you think that we are just targeting at 15% more?
15% because of the projected market and because of the startups more like me, probably people coming in the industry.
So does that mean that, that people will be falling more sick? God forbid, just to increase that 15%?
People will be more conscious with the healthcare modification.
So rather than getting sick, they will still be going to the hospital. That's what
I think the industry share would be grabbed at the very early point where I'm talking about the preventive care and early detections.
Wonderful.
So coming back to the health commerce, how I envisage it happening in Pakistan is that I would like to mention that I do podcasts. And I've been a great listener to different podcasts. So there's a healthcare company, Informatech. Right. The head of the health tech is Felix Beecher. He recently did a podcast with a chat GPT bot.
Oh, wonderful.
So the guest was not a human. It was actually a robot.
Yeah.
So he was talking about...
I'm rightfully threatened by that jobs because I feel that chat GPT might take it over.
And people who actually want an ear, they can certainly talk and say whatever they feel like saying.
So I think Elon Musk rightly said that it's scary good. But so Felix asked the same question, that how are you scary good? So the language generation abilities, as we're exploring it and as it is developing, yes, it is scary, but there are a lot of things where it can come into health commerce, telling people not only by the app, but obviously because of different, for example, if I'm wearing I'm wearing a smartwatch, it's already monitoring a lot of vitals.
Yeah.
How this watch can be connected to the mobile application that I'm developing and telling you at the right point of time. For example, if a woman conceives, there are going to be certain appointments, certain medicine, certain multivitamins, certain doctor appointments, certain tests, discounts on the tests, making them available. And after you deliver the baby, there are going to be a lot of products coming in need for the baby as well. That is where the health commerce is making the right, smart, optimum decisions for you. That's how I see it.
Exactly. Thank you so much for saying that. But there is, I think there should be some room for skepticism in all of this because obviously when we talk about the artificial intelligence and the data gathering and the big data, so there's a lot of debate on how we need to prevent it from falling into the bad hands or into the bad habit, or the data privacy is a major concern. So how will you ally all of these concerns regarding the data privacy and data security? And especially the doctor to physician to the patient conversations, they are very confidential, right? But when it is translated into data, it might have some sort of data privacy concerns in all of that equation. So how are you going to ally those?
Because we over here in Pakistan, are witness to so many leaked calls now these days as well. So imagine if that's not safe, what can be?
I think
that's a challenge, though.
that's a very pertinent question.
Yeah.
But we will make sure that all the safety protocols and the confidentiality, international certifications are there. They're in the place, and we're going to use the local servers for now. We're not going cloud-based right now.
Okay,
so because that has a lot of more skepticism, as you said.
No, but even if we go cloud-based, that's not. I think that's fair enough, because imagine that you know, for this I will actually have to name the company. So Jazz actually came up with their own iCloud service as well. We cannot call it iCloud, but you know, obviously cloud services, and they go by the name of Jazz Garage. You know, so they've launched it because the data is going to stay within the country. Wherever you are, you can use it remotely, and I think that will certainly be the need of the hour as well, because if we are to build on such applications and maintain that data. But having said that, I think that the risky part is where you said that, you know, this AI and this technology will be taking all of those rightful optimum decisions for us. That's word to word with what you said. I think that's where people will be taking a step back and be like, yeah, how can we let an application decide whether what to decide for us, you know? So that's something which I believe, you know, even for me now, if I am to think about, okay, you know, this is what's wrong with me, and I write it in the application, obviously the generic outcome would certainly be the similar for each and every patient out there. So how do you think that it's going to be need-based? Because, you know, most of the times when we go to the doctor, I'm sorry, but most of the times when we go to the doctor and the doctor starts to take your history, I think that the symptoms are majority of the time same. Sir, idhar bharipan महसूस हो रहा है. Sir, gas हो रही है. Sir, I mean, you know, for an application to answer all of these questions, I think it will be difficult, no?
I'm so grateful that you asked this
Thank
question. Okay, so I'm going to start with an example. One of my friends is a consultant radiologist. So a patient came with the history of abdominal pain because of stomach and bowel issues. And she was insistent of getting a scan done. But after taking the history, my radiologist friend suspected of renal stones. And she did the scan otherwise, and she found a tumor. So something that started out very small turned out to be a lot more of a big deal than it was supposed to be, right? So I'm not saying that, so what is, you know, there's a lot of hype about AIs and algos and ChatGPTs. What ChatGPT actually is for a layman like me is that it's a neural-based language generation program, right? What is AI? AI is artificial intelligence. It is created by the real intelligent human beings. So we are the ones controlling it. They're not in the driving seat. Even in, you know, the cruise control cars, when you lift your hand from the steering more than 3 times, it just turns off the autopilot mode for 2 hours.
Really? I never tested this. I got to know about this for the very first time. Well, I might have taken my hands off once or twice, but not thrice. Okay, I think that's a new thing for me. Thank you very much for sharing that, but please continue.
All right, so my point is that it's not taking the control 100% off your hand, right?
So it's just preliminary.
So even if I'm the one setting all the equipment and you know, the applications and algorithms for data collections for my, you know, big data in the cloud, I'm the one controlling it. I'm going to deploy humans who are trying to control and create and sophisticate it even more, evolve it even more with time. So that is what I mean when I say that AI is going to be there. ChatGPT will probably create reports for doctors, but doctor is going to be there to understand if the report is pertinent to the customized approach.
So one last question, if the doctor is going to be there and eventually if you will have to be you know, physically present in front of the doctor, why do we even need all of this health technology?
You don't have to physically be present in front of the doctor.
Really?
Yeah.
Okay, so how do you think that, you know, that you know, somebody who actually went in with stomach issues ended up figuring it out that it was a tumor because she was in front of the doctor, no?
Achha, good question. So again, thank you. So hospital is also working on remote radiological and diagnostic procedures. That is
That's
again
very
going to
expensive,
be.
yeah. You know, even if they bring the machine from first floor to fourth floor for a patient, they charge you hefty amount of money.
Oh, that's where the hospital affordability and accessibility is going to come into it. That's my competitive edge.
Wow, that's wonderful. Thank you very much for saying that as well. But
Thank
you very much, Ms. Sana, for answering all our questions.
Thank you.
We just acted like newbies today, ladies and gentlemen. And certainly, why not? You know, there's newer technology out there. We want to learn, and we want you to learn about it as well. And it was our humble effort and initiative. We want to wish you best of luck.
Thank you.
Please make sure that you do that and that you make a lot of more people out there healthier, that they live longer. And inshallah, you'll get a lot of duas for that as well. But for now, ladies and gentlemen, we're actually going to head out towards a short break.